Greetings everybody, I'm Sheldon Bateman, I'm a physical therapist at Body Forte, and today we're going to be talking about carpal tunnel syndrome. My trusty assistant Mildred here is in a position that is very challenging for people who have carpal tunnel syndrome. It's actually one of the main causes of carpal tunnel syndrome, especially historically. And what we're going to be talking about is what it is, what causes it, what can you do, what do you feel, and so on. Okay? So let's jump in. Most of us have heard about carpal tunnel syndrome before, but what really is it? Okay, so carpal tunnel syndrome is, simply put, the simplest way, impingement on a very vital nerve that comes down the forearm and then goes through the wrist and then it spreads out into the fingers, okay? And this, where the nerve runs, is generally where most people feel symptoms, okay? So the nerve gets squeezed at this point here where there are a lot of other structures coming through. You have muscles coming through here, and they all have to fit and pass through here comfortably. Now, if for any reason there is something that causes less space for the nerve to pass through, then it's going to cause pain from that point of impingement further on into the fingers, okay? So most people will complain of numbness, tingling, pins and needles in the thumb, the pointer finger, the middle finger, and sometimes a slight portion of the ring finger of the affected hand. And this numbness is what generally triggers people into thinking and saying that they're having some sort of issue. A lot of people end up flashing their hands, and that might help, because sometimes that might just loosen up things just enough to give you temporary relief. However, if you really want to solve the issue, then it's best to get evaluated by a physical therapist, and then you can go into treatment and figure out what exactly is causing your median nerve, and that's the name of the nerve, by the way, the median nerve. What's causing that nerve to be impinged or squeezed? It can be from various things. It can be from a position like Mildred is in here. So your wrist is in this position all day, you're typing, you're answering the phone. These types of things will cause a lot of increased tension on the nerve and even compress it at certain points depending on the position at which you hold. Okay, so it's very important to have your workspace evaluated properly. You need to reduce anything that aggravates you, and then you can work also on getting flexibility to the nerve, flexibility to the other structures that pass through the carpal tunnel, and also exercises to strengthen and increase further that flexibility, if flexibility is your problem. Okay, so that's just a little tidbit on what carpal tunnel is and some other bits of information to help you in figuring out what to do if it is that you are having these symptoms. If that's you, then maybe this is a video for you. So a lot of people have a lot of numbness or pain in the wrist extending into the fingers, causing what is known as carpal tunnel syndrome. And it starts in bad postures. So using the wrist, using your upper body posture in a bad way can trigger this carpal tunnel syndrome to be something that's now personal to you. So in the first instance, before we even get to exercises or anything, your posture and your workstation must be very ergonomically sound. Your desk should be at the level of your armrest. You should be flat-footed on the ground, back nice and straight. Your screen should be nice in front of you at eye level. and that way you are able to type and use your computer or use your desk more efficiently. Now, if changing your posture and how you relate with your workstation is not the only thing that needs to be done, and there is still more that needs to be done, then there are a few exercises, and we're going to go through two things today that will help you, or should help you, to reduce your symptoms of carpal tunnel syndrome and to help you to live a better life. One of those things are what we call nerve bladders. Now, nerves are very gentle structures and they react to undue stress and strain very acutely, like shooting pins and needles, burning pains, or numbness within wherever they service. So sometimes when we just gently glide those nerves, they get relaxed. It's almost like a massage for nerves, okay? And what that is pretty much a position that you do a few little movements, okay? And here's how it goes. So you're sitting up nice and tall. You're going to extend the affected hand out to the side, palm up, okay? You're going to turn the head the other direction and tilt it down ever so slightly. Then once you're in this position, it's already I'm kind of feeling a little bit of a stretch happening, and then just move the wrist up and down. You can do this maybe about 10 times, take a break, and then do another set of 10, right? It shouldn't regurgitate the symptoms, it should soothe them. So if it is that it's causing more symptoms to occur, then maybe you're not ready for such an exercise. Sometimes this is going to be our second exercise or activity. Sometimes carpal tunnel can just be caused by tight muscles coming down and feeding into that carpal tunnel where the nerve runs through and infringing on its space and causing it to become agitated. So sometimes just some simple stretches to these muscles, so just that gentle pull down, can open up that carpal tunnel by reducing the tension in those muscles. Those are just two very simple, very basic, and again might not be one size fits all, meaning it might not be the exercise for you specifically. To stop you from hurting yourself or causing undue harm, it's best that you get properly evaluated by a professional vis-a-vis some sort of physical therapist individual, a trained physical therapist. This is the type of individual who you want to go to ensure that you're doing the right things for you specifically. Alright, so this is Sheldon Bateman saying, stay safe, keep moving. Thanks for watching. If you liked our video, please give us a thumbs up. Leave a comment below if you have any, or any questions if you need. Follow us on all our other social media platforms, Instagram and Facebook at Body40 Ltd. Click the notification bell so that anytime we post new videos, you will be the first to know. And subscribe to our channel. Peace out, guys.